There are various tests we can do in the non-invasive diagnostic lab. For example, you can do the ECG, electrocardiogram, to actually record the heart rhythm. This is especially important for those patients presented with palpitation because we don't know whether this palpitation is a normal response or it's because of the short circuit. So the ECG will tell us whether this is a normal response or this is due to short circuit. They show us whether there's arrhythmia, whether the heartbeat got extra beat or whether the heartbeat actually stopped. Okay, that's one thing. And it's good to detect previous heart attack, or if the patient came with a heart attack, the ECG will show the dynamic changes. Of course, for example, for those patients who have no symptom, ECG can be normal at rest. But when you start to stress them by putting them on the treadmill, we call it stress ECG. Okay, we can actually reproduce the symptom. So what the stress test done is actually we put the patient on the treadmill, we stress the heart. If there's a blockages of coronary artery, during exercise, our heart need more blood supply. But because of the fixed narrowing, the supply is not met by the demand. So as a result, patient might complain of chest pain, short of breath, or cold sweat. And the ECG will actually show the dynamic changes, the ST elevation or ST depression. That will help us to pick up the ischemic heart disease. No doubt the accuracy is not very high, but it's as high as 79%. Okay, and then for those patients who presented with palpitation, we know sometimes palpitation can be quite short. So in order to increase the detection rate, we can do a 24-hour recording. We call it Holter. It's actually 24-hour ambulatory ECG recording, which can actually record your ECG throughout the day, even when you sleep. If you happen to have palpitation at night and you have no time to rush to the clinic, at least this event is being recorded on the Holter. Okay. So other tests including the echocardiography, as we explained just now, the 2D echo, 3D echo, and tri-esophageal echo. Basically, it's like ultrasound we used to detect the baby during pregnant. So this is ultrasound of heart. It visualizes the heart. Okay, they visualize the heart muscle, the valve, okay, and the blood vessel. So they can tell us whether the heart chamber is dilated, whether the heart wall is thickened, and whether the valve is narrowed or leaked. Okay. So other tests including the CT scan. Okay. Basically the test involve injection of the dye. Okay. Then the CT scan will take multiple X-ray. Then they use the computer algorithm to deconstruct the picture to give you a 3D images of the heart, which show up the coronary artery. Okay, they'll show you whether there's any blockages. If there's blockages, where is the blockages? And for those patients who confirm to have blockages, then we'll bring them to the invasive lab, whereby we'll do a coronary angiogram followed by balloon and stenting. Okay, so another important test we have is the cardiac MRI, whereby it's a very powerful tool to detect heart failure. It can actually help us to diagnose the heart failure and to find out what are the potential causes causing heart failure. For example, whether there's an infiltrative disease, okay, whether there's a congenital causing this thickened heart, we call it hypertrophic cardiomyopathy.